Emergency fatigue threatens the precious gains we have made against this virus. Reports of distrust in authorities and conspiracy thinking are fueling movements against social and physical distancing. Other people are behaving overcautiously, which continues to limit their social interactions and access to health services, for example. Mistrust, resistance to measures, a disregard for the behavioral changes we have all made to limit COVID-19 will send us down the road no one of us wants to take. Simply put, our behavior today will set the course for the pandemic. As governments lift restrictions, you, the people, become the main actors. It's an individual as well as a collective responsibility. Do follow the recommendations of your national authorities. Limit social interactions. Keep washing your hands. Maintain physical distancing and reduce risk to the most vulnerable in our society, the elderly and those with chronic underlying health conditions. They rely on the choices you make. So my 3 messages today. 1. Communities, remain vigilant and protect the gains. Our complacency is COVID-19's playground. 2. Policymakers, keep attuned to what people are doing. Listen, learn and adjust measures accordingly. 3. To us all, we all have a role to play to keep COVID-19 at bay. Our behavior determines COVID-19 behavior. It's up to us now. Thank you.
We'll next go across to the Cyprus News Agency and Avi Mitsoudou Phillips. Avi, please go ahead.
Hello, thank you for taking my question. I'm going to go back to the Mediterranean, surprisingly, and ask, as the summer approaches and lockdown measures are easing down, I think many people are really looking forward to enjoying their time in the sun and the sea. And what I would like is your advice about how best to do that. Thank you.
Okay, Richard, I'm going to go to Richard first, and then I'm going to go to Katrine to add a few points on this from the behavioural perspective. So Richard first, please.
Yeah, again, it's a great and important question. Of course, it very much depends on the local situation, the extent of transmission of COVID-19 and the local measures that a particular country has in place, how much of the lockdown measures may have been eased and so on. But whatever there is, there are still the core underlying measures that people should undertake, and those, of course, relate to the issues of ensuring that the usual physical distancing measures are put in place, the 1 meter rule, and that all the usual measures as well around sort of hand and respiratory hygiene to help to reduce the transmission of the virus. And then, of course, there's the measures which the local authorities need to endeavour to have in place to ensure that the beaches and places where people might gather are a safe environment to, again, try to minimise any risks of onward transmission. Over and out.
Katrine, would you like to add to that?
Well, I can certainly try to. So the way I understand your question is that if we have people who really want to engage in a social activity that is actually against the recommended behaviour, how can we then cope with that? And I think there are 2 things that need to be considered in that. I think, first of all, we need to make sure that we listen to the public and understand the fatigue or the barriers that they're facing and the competing interests that they're facing and their needs at some point to also be able to engage in activities that are important for their mental health and well-being. So that's the one thing that we can try and understand where they're coming from and where that need is coming from and how important it is. The other thing, of course, is how can we continue to find ways of appealing to people so that they follow our recommendations. And there are many ways of doing that. And again, through doing surveys, we can understand who do people trust, what are the prevailing norms, are there any trends or shifts in norms where we can see that there is a declining willingness to follow recommendations. And if there is, we need to do something about it. And so I think countries are doing a lot of brilliant things to try and make sure people follow recommendations. And one of those things may be to understand who do people trust, and what are the role models, the trusted people, the religious leaders, the community leaders, the influencers who can help strengthen social norms in a way that will make people follow the recommendations so that we can continue to control transmission while still perhaps allowing people to engage in some social activity.
From Konstantinos Davanis from ERT, Hellenic Public Television. And this is over to you, Richard Pebbody. Richard, Konstantinos asks, in Europe and Greece, the tourist season is about to start as Greece already has low transmission rates. Greece suggests tourists taking a test 3 days before the trip. Is this considered an appropriate way to protect visitors and residents of the country? I don't think it's just Greece that have asked us this question recently, but many other member states, particularly those in the Mediterranean region. So over to you, Richard.
Thank you very much, Rob. So this is a question which is arising in a number of different countries as we move into the summer season, and quite rightly, countries and people are wondering about their summer vacations. Clearly, this really needs to be undertaken involving a very careful risk assessment by the countries involved, involving understanding what the local transmission is, and also a close interaction as well with the countries where tourists are going to be arriving from. So no clear answer here. It's really for Greece to consider where the tourists are coming from, a local risk assessment, and based on that, make decisions on helping to support the local economy, which of course is really important. Over now.